This is a picture of anatomical position. Anatomical position is a person standing upright. Their face is forward, their palms are facing out with the thumbs pointing to the outside, their feet are flat and pointing forward. And this position standardizes the way that we think about the human body. So when one person is describing something about the human body, the other person is picturing anatomical position. So it helps to eliminate miscommunication and errors. The body has various regions. Understanding these regions and remembering them can be super helpful when it comes to naming bones and muscles and nerves, because a lot of the naming conventions in anatomy have to do with body regions. The first region that we'll look at is the abdominal region. That's your stomach area. You might think of your rectus abdominis, your stomach muscles. The axillary area, that's your armpit. The antebrachial, anti means before, brachial, before your brachial region, so that's your lower arm, antebrachial. Your brachial region is your upper arm, so like biceps brachii, triceps brachii have to do with the brachial region. Carpal is your wrist, so think of like driving a car with your carpals, that's your wrist. Cephalic is your head, like encephalitis. The itis is an inflammation, cephala has to do with your head. Cervical is your neck, so cervical vertebrae, for example, are in your neck. Costal is your ribs, your rib area, so intercostal muscles are in between your ribs. Crural is your leg, that's from the knee down to your ankle. Digital is your fingers, so think about like your 10 digits. If someone's like, ooh, can I get your digits? You can be like, yeah, there you go. Dorsal is the backside. Think of a dorsal fin. Right, it goes along the spine side. Femoral is your thigh. So from your waist down to your knee, that's the femoral region. So like your femoral artery or your rectus femoris and your femoral region. Genital region, that's where you have your reproductive organs. Gluteal region, like gluteus maximus, that's your buttocks region. Inguinal, that's going to be where you have your pubic hair, let's say, the inguinal region. Lumbar, lower back, so like lumbar vertebrae are in your lower back. Nasal has to do with your nose. Think of like nasal cavity or nasal spray has to do with your nose. Pectoral is your chest, like pectoralis major or pec deck, the exercise, it's your chest. Pedal is your foot. Think of yourself pedaling a bicycle. That's your foot. Plantar is the sole of your foot. So think you plant your foot, or plantar fasciitis. Tarsal is your ankle bones. So just like your wrist are carpals, your ankle bones are tarsals, like North Carolina tar heels, tarsals. The thoracic region is your upper body. So think of like head, thorax, abdomen. Vertebral, that's your vertebral column, your backbone. And patellar, think of like pat your kneecap, pat your patella, that's your kneecap. And that'll give you some ideas of some regional terms. Relative terms are just that, they're relative to one another. They're not fixed positions. So anterior refers to like toward the front. So in this cat, the nose is anterior. But if the cat stood upright like you did, the front side would be anterior. The back then is posterior. So in this cat, the tail is the posterior. But for you, if you're standing upright, that's your gluteus area, that's your posterior, your back. Proximal means near to. So the elbow is proximal compared to the wrist, whereas distal is far from. So think of it like close proximity, very distant. So your fingers, the digital region, is very distant compared to the axillary region, your armpit. Superior means above, like if you are superior to someone or you have a superiority complex, you're above everyone. So the ears are superior to the eyes. Inferior means below. So if you have an inferiority complex, then the eyes are inferior to the ears. Inferior means below. So like the eyes are inferior to the ears or below. Prone means face down. So to pronate means to be face down. So like palm down is also pronate. Whereas supine means face up. So think of it like you're carrying soup. Or you can think of it like supine on the spine. So you're laying on your spine That's the supine position. Intermediate means exactly down the middle. Like this stitching right here is intermediate. It's exactly down the middle. Medial means toward the middle. So for example, your ribs are toward the middle, whereas your elbow is more lateral toward the side. All right, so lateral toward the side, like a median strip in an interstate's right down the middle. Ipsilateral means on the same side. So like your right arm, right leg are ipsilateral, whereas contra, which means opposite, like if someone's being contrary, they're being opposite, your right arm and left arm are contralateral. They're opposite to each other. Superficial means right along the surface. So like the fur is superficial, like a paper cut is superficial. But if you were to step on a nail, that's deep. It's way below the surface, deep inside the surface. There are several human body planes. The transverse plane divides the person top to bottom. Frontal divides them front and back. So like this seam right here is frontal. That would be the frontal plane, front and back. Sagittal divides them left and right. So like the brown and black seam here would divide left and right, sagittal plane. This diagonal shape one is an oblique plane, Your body's divided up into several compartments or cavities. There's the dorsal cavity. Remember, dorsal means the back side. And then there's the ventral cavity. The ventral means the front side. The dorsal cavity is completely encased in bone, and it consists of two cavities, the cranial cavity around the head and the spinal cavity that's holding the spinal cord. The ventral cavity is not completely encased in bone. The thoracic cavity, which has the rib cage, that is, but the abdominal cavity is not. So the abdominal, or sometimes referred to as abdominopelvic cavity, that would include the abdominal cavity and the lower pelvic cavity, abdominopelvic. But this is not encased in bone, whereas the thoracic cavity is encased in bone. The division between those two cavities is the muscle called the diaphragm. The thoracic cavity we can further subdivide into the cavities that hold the lungs. Those are pleural cavities. And then the cavity that holds the heart, that's the pericardial cavity. And then in between the lungs and above the heart is the mediastinum, another small cavity. The abdominal region is such a big region, we can subdivide it into 9 smaller regions. And you might be thinking, 9 regions, that's terrible. Well, it's not as bad as it sounds, because there's a right side and left side. So think of a person who's sick all the time, holding their arm around their waist. That's a hypochondriac. And the right side of that person's body is the right hypochondriac region. The left would be the other side. Then, just like lower back for lumbar, the right lumbar region. And then the iliac, that's your ilium, your pelvis bone, where it sticks out of where your belt is. That's your ilium or iliac crest, and that region is the iliac region, so right and left. Where the belly button is, that's the umbilical region. Above that is the epigastric, above gastric stomach region. Hypogastric is below the belly button, hypo, below gastric stomach. What I'm going to do now is show you some pictures of different medical images that we can use to study things about the body. So for example, there's an X-ray. An X-ray is really helpful for dense tissue like bone. But repeated X-ray exposure can cause cancer. So there's a downside to X-rays. An angiogram is a great way to see blood vessels. Angio has to do with blood vessels. So by drinking some contrast, you can get a medical image of your blood vessels. A CT scan is a great way to see a clear, thin slice. So you can see kind of layers going down by using a CT scan. So what does the brain look like at the top, working your way down more from superficial to deep? We can get a real clear image. An MRI has to do with magnets. All right, so this is mostly to view soft tissue. The trouble here is that it's a long exposure, but you get a very good image. But it's a very long exposure, like 45 minutes or more, to get a good, clear image of an area of the body. PET scans are kind of low resolution, but what they're showing is metabolism. So the more the cells use energy, the more yellow and red they become. So red means they're using a lot of energy. As they use less energy, they become more green and blue and purple. So purple, those cells aren't using hardly any energy. So it's not super clear imaging, but it's showing us the metabolic processes of the cells. And then a sonogram or an ultrasound. What you're seeing here is sound waves bouncing back, and it's not a super clear image, but it's really good for seeing things that are moving, which is often why technicians use this to show mothers their infants, because I can pick up that image even if the baby is moving around inside. And that concludes this video from chapter 1.